Good morning, sir. Today, I will discuss some of the effects of diabetes on human behavior. But first, let us know what diabetes is. Diabetes is a chronic health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems such as heart disease, vision loss, and kidney disease. You are more likely to develop diabetes if you are not physically active and are overweight or obese. Extra weight sometimes causes insulin resistance. Another factor is insulin resistant, a condition in which muscle, liver, and fat cells do not use insulin well. As a result, your body needs more insulin to help glucose enter cells. Another cause is genes and family history. Now, let's talk about some of the effects of diabetes on a person, physically and behaviorally. First symptom is risk of stroke. Someone who is diabetic is 4 times higher than someone who is not diabetic. Diabetes can also raise your risk of bacterial years and fungal infection, and the feet are the most vulnerable to this. If a person has diabetes, he has an increased risk of heart attack and high blood pressure, and also poor blood sugar management can cause delay in emptying of food from the stomach that can cause bloating, nausea, and heartburn. Diabetes can be effectively managed when diagnosed early. However, when left untreated, it can lead to potential complications that include heart disease, stroke, kidney damage, and nerve damage. Now, behaviorally, how can diabetes affect one's behavior? Diabetes affects much more than blood sugar. It can lead to sudden mood changes that may place on emotional strain or on relationships and personal life. For some people, the stress of living with diabetes can contribute to both changes in mood and concerns about potential complications. The physical effects of diabetes may also lead to nervousness, anxiety, and confusion. Sometimes, friends and family may struggle to understand these mood swings, but learning about how diabetes can affect mood and providing support can help promote a stronger, healthier relationship. The symptoms of low sugar levels that might contribute to mood swings include confusions, hunger, coordination, and decision-making, difficulties, aggression, and irritability. Personality or behavior changes, concentration difficulties. Having diabetes can also lead to a mental health condition that products called diabetes stress. This condition shares some elements of depression, anxiety, and stress. Some people with diabetes may also stress and powerlessness when trying to control their condition. Others may believe that they are not doing a good enough job in managing their diabetes. Others may experience anxiety about whether their blood sugar is too high or too low, or worry that they will not recognize low blood sugar quickly enough to avoid social embarrassment or danger if it occurs during sleep or while driving. Some people become distressed by worrying about what a friend will think about their diabetes or whether will treat them differently. Family and friends may become overly involved and treat them as fragile or try to manage their diet or exercise for them. Having a diabetes can lead to aggression and violent behavior. Aggressive and violent behavior are restrained by self-control. Self-control consumes a lot of glucose in the brain, suggesting that low glucose and poor glucose metabolism are linked to aggression and violence. Glucose is brain food for self-control, and people who have difficulty metabolizing glucose also have difficulty controlling their aggressive impulses. That will be all. Thank you and stay safe.